Hey, welcome back to Not So Complicated. This is another episode on 5 minutes, 5 high-yield drugs, including anti-arrhythmic drugs like Amiodarone, Lidocaine, Adenosine, Sotalol, and Verapamil. Let's begin without further delay. The first drug is Amiodarone. It belongs to class 3 anti-arrhythmic, but it also has effects in class 1, 2, and 4, right? And the indications or uses of this drug are ventricular tachycardia, fibrillation, and atrial fibrillation refractory to other drugs. And the mechanism of action of this drug is that it prolongs an action potential duration, that is APD, by blocking potassium channels, slowing repolarization, right? So slowing repolarization, it prolongs APD, and it also blocks sodium calcium channels and then beta receptors. The side effects are pulmonary fibrosis. We have to consider PFT, pulmonary function test, hepatotoxicity, so LFTs, and thyroid dysfunction. This is like major contraindication in patients with iodine allergy because it can cause either hypo or hyperthyroidism, right? We also have to do monitor thyroid function tests time and again, and blue-gray skin, and also corneal deposits, right? So the USM Lipol is that it has long half-life for that is for weeks, right? And monitoring LFTs, TFTs, PFTs, I have talked about it. Contraindication also, it also shows drug interactions via CYP for 50 inhibition with drugs like warfarin. So we have to consider that, right? So the other drug that we have is lidocaine. Lidocaine belongs to class IB antiarrhythmic, and the indications are ventricular arrhythmias, right? BTVF, that is tachycardia, fibrillation post MI, that is myocardial infarction, or during cardiac arrest, it can happen, and then it can work. And the mechanism of action is that it blocks sodium channels in ventricular myocytes, reducing phase 0 depolarization, and especially in ischemic tissues, it also shortens action potential. And the side effects of this drug are CNS toxicity, obviously, and seizures, confusion, tremors, paresthesia. It is because lidocaine is usually used in anesthesia also. The USMLE pole of this drug is that it is preferred in ischemic settings due to selectivity for depolarized tissue, and we have to do IV administration only for arrhythmias, which is not used orally, right? And we have to avoid in WPW syndrome, that is Wolff Parkinson's White syndrome, and then monitor for neurotoxicity, especially in liver dysfunction or elderly patients. The other drug we have is adenosine. It does not belong to any Vaughan Williams classification, that is class 1, 2, 3, and 4 of antiarrhythmia. It is just adenosine, right? The indications are supraventricular tachycardia, SVT, and then especially AVNRT or AVRT. This is a homework for you. And then the mechanism of action is of this drug is that it activates A1 receptors in AV node, increasing potassium efflux, and that will lead to hyperpolarization of cells and slowdown of AV conduction, and that causes transient AV block, right? So this is the function, this is the mechanism of action. The side effects are flushing, that is extensive vasodilatation in facial region, right? Redness of skin and chest pain, brief asystole can happen, and also dyspnea, that is difficulty in breathing. The USM Lipol for this drug is that it has ultra short half-life, that is less than 10 seconds, given as rapid IV push with flush, and it is contraindicated in asthma because it has a risk of bronchospasm or second to third degree heart block, right? Because the mechanism of action is itself heart block, and methylxanthines reduce efficacy. First line drug for SVT, supraventricular tachycardia termination, is adenosine. The other drug we have is Sotalol. It belongs to class 3 antiarrhythmic with class 2 effects. The indications are sustained VT, AF maintenance, and atrial flutter. The mechanism of action is that it is non-selective beta blocker, that is class 2 effect, and also potassium channel blocker, that is class 3 effect, and prolonging action potential and QT interval, both of them. The side effects are torsades de pointes, which is QT prolongation, and then bradycardia or fatigue. The USM Lipol for this drug is we have to monitor ECG for QT prolongation. Risk of torsades is highest with hypokalemia or hypomagnesemia, and it is contraindicated in baseline long QT syndrome or renal failure. Now it drug accumulates, right? So we have to start in hospital with ECG monitoring. The final drug we have is Verapamil. The indications are SVT, that is rate control, and also atrial fibrillation or flutter, that is also for rate control. The mechanism of action is that it is non-dihydropyridine calcium channel blocker and slowing phase 2 of action potential in AV node, reducing conduction and heart rate. It is also used in hypertensive patients. The side effects of this drug are hypotension, bradycardia, constipation, and heart block. And the USMLE poll for this drug is that it is contraindicated in ventricular tachycardia because it can cause hemodynamic collapse or heart failure, negative inotropy, and avoid with beta blockers due to additive bradycardia. We have to monitor BP and ECG and preferred for SVT in stable patients. That is all for today. Subscribe for daily doses like this. Thank you for staying with me.